Alrighty, good afternoon, Dana. I'm Zena. I'm going to be your nurse today, and we're just going to do a basic physical assessment on you today. Okay, the first thing I'm going to do is I'm going to inspect your skin on your head and your face, just to make sure, have you had any issues with skin being dry, excess acne, facial hair, etc., etc.? Okay, and it correlates. Good, you guys.
How long was yours?
I would also check color, temperature, moisture, texture, edema, turgor, bruising, scars, etc. on everything. Okay, and then I would check your head for size and symmetry. If you'll just look at me, everything looks symmetrical and beautiful. Her head is in the midline position. Also, the next thing I would do would be to palpate her head and her scalp for anything, and especially her fissures. Alrighty. You just basically make sure that her hair is distributed beautifully, the color of the scalp, texture of the scalp, any lesions, masses, etc., like everything. The next thing I'm going to do, I'm going to palpate your temporal arteries, and if you'll just tell me if you have any tenderness or if you don't have any tenderness, okay? Okay, and the next thing I will do, I'm going to palpate your lymph nodes. Now I'm going to start with the preauricals right here, right in front of your tragus, and then the postauricle, and then the occipital, and then the tonsillar and submandibular, the submental, the antecervical, the postcervical, and the supraclavicular. Okay. And then to test for cranial nerve number 5, I'm going to test also for TMJ. So I'm just going to put my hands right here, and if you could just open your mouth and close your mouth. It's beautiful. Okay, and then let me check for it again with a different test, and this time I'm going to touch areas of your face while your eyes are closed, and you just tell me if you can feel it, okay? Alright, in cranial nerve number 7, we're going to check to see if we can you smile for me? I'm going to check for symmetry, okay, and frown. Okay, and then can you raise your eyebrows and make your cheeks like a puffer fish? Alright, good job. Okay, and then next thing I'm going to inspect your ears just to check them, and I'm going to pretend that I have a little thingy to look in your ears. Okay, when you look in the ear, on the right side I'm going to look at 5 o'clock. And you have a wonderful, dull, gray, tympanic midbrain. Now I'm going to look over here, and I'm going to look at 7 o'clock, and same beautiful thing. Alrighty. Now, I'm going to go ahead and palpate the pinna to see for any abnormalities in your tragus on both sides, just to see if you're doing great, and you are. Okay, so for cranial nerve number 5, I'm going to take my little thingy that makes vibrations here, and I'm going to hit it, and I'm going to do the Weber test, and the Weber test is going to hit, I'm going to put this on top of your head, and you tell me if you feel the vibration, okay? Alright. You feel it? Mm-hmm. Okay. And then I'm going to do the Rhine test, and that's going to be right behind your ear, and you tell me the exact same thing, okay? Okay? Alright, do you still hear the vibrations? Yeah. Okay. Alrighty. So the next thing we are going to do, because we've already assessed for all that, I'm going to go to your eyes. I'm just checking for your eyelashes to make sure they're distributed appropriately. Eyebrows, to check your conjunctiva and to make sure that everything is red and beautiful. Good. Okay, and then you have no discharge, so that's great. Okay, now we're going to look at the Snellen chart that's going to be right in front of you. Can you? Yeah. And if you could just cover your left eye. And then can you read the third line down for me, please?
1, 2, 3.
Alright, and if you'll do the same with your right eye.
1, 2, 3.
Okay. Alrighty, now on this I need to check cranial nerve number 3. We're going to check for your pupillary response, and this is where I would turn the light off. And 10 light. And hers even reacted in the lighted room, so we're good. Okay, and then for test number 3, this is when you're just going to have to follow my fingers, and we're going to check for cranial nerve number 3 as well as clean the number 5 and 7. Okay, alright, well, let me use this thing. Okay, go like this. Alrighty, beautiful. Now, that's 5 and 6 with the wagon wheel. And then, okay, and now we are going to see if we can check out your nose today. So, in the past, have you broken your nose, had any issues with nasal deviation? Deviated septum. Deviated septum, not nasal deviation, okay. And then, okay, and then we're going to check your sinuses, okay? Right around your nose, your maxillary and your frontal. Okay, now we're going to inspect your mouth and your tongue. If you could just open your mouth, and while you're saying you're open, can you say ah? Alrighty, beautiful. And we've already checked TMJ. Let's see, can you stick out your tongue for me? Awesome. Okay, so next thing, we're going to move down to your neck. Now I'm just going to be inspecting the skin. Have you noticed any color changes, any excess hair growth, acne, etc., etc.? Okay, alright, beautiful. And I'm just going to look at it, and I'm going to make sure your trachea is at the midline. Okay, and then I'm going to palpate your carotid right here. And right here. Beautiful. And I'm going to go ahead and auscultate over the carotid for bruise. And for the bruise, you always listen to the bell. And no bruise. That is beautiful. Okay, now before I ask you to sit up so I can check for your thyroid gland, I'm going to go ahead and see if you can just shrug your shoulders and push against me, okay? Good job. Alrighty, and if you could lean forward for me, I'm just going to feel to make sure that your thyroid's in the right position. Okay, could you swallow please, ma'am? Alrighty. Okay, now I'm actually going to ask you to sit on the side of the bed. I'm going to check your posterior chest. Okay, and the first thing I would do is I would inspect her skin, again, for alteration in color, texture, moisture, and all the other great stuff. Edema, turgor, bruising, scars, lesions, moles, so on and so forth. Okay, and also during this assessment, during the chest, you would check to make sure that they are not in respiratory distress. So you would assess to see if they're using their accessory muscles for breathing, their tripod positioning, obviously not. Okay, and then I just inspect the back of her chest to make sure that everything is symmetrical. And then I will palpate, and can you breathe in for me, please? Thank you. And then can you say 99, please?
99.
And again?
99.
And again?
99.
And again.
99.
Okay. And then I'm going to listen to your lung fields real fast on the backside, okay? Alrighty. And can you go ahead and we're going to test for egophony, bronchophony, and the whisper test. Can you please repeat the letter E for me, please?
E, 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 E.
Okay, and then 99.
99, 99, 99, 99, 99, 99.
And if you'll whisper for me, please. Alrighty, and the last thing I'm going to do on the back of your chest is I want to profess over the lung fields, okay?
I didn't either.
Okay, alrighty, I'm going to move back to your anterior chest, so if you could just lay back for me, please, ma'am. Okay, now this starts again. I would inspect her skin for abnormalities, again, just everywhere. Okay, and then now I'm going to text again. If you wouldn't just breathe for me, please. I'm going to tactile and it's wonderful. Okay, and now I'm just going to listen for your lung sounds on the front, okay? Alrighty. Now we're going to move on to the heart, and I'm going to begin with listening to your heart sounds while you're laying down, and then I'm going to ask you to stand, and I'm going to do the exact same. Okay, so I'm going to start with listening to the aortic, which is right here, and the pulmonic, Erb's point, tricuspid, and your mitral. Now your mitral is going to be your point of maximal impulse, and that's where your apical pulse will be. Now I'm going to auscultate for the apical pulse for a full minute, and then I'm going to record your rate rhythm, okay? Okay, thank you. And if you could stand so that I can listen to your heart sounds again, please, ma'am. Thank you. And again, I would start with aortic, move to pulmonic, Erb's point, tricuspid, and then mitral again, okay? Alrighty, and thank you. And can you lay back down for me, please, ma'am? Alrighty. Now, everything is good so far. Let's see. I'm just going to check for JVD real fast, okay? And you're good. Sounds great. Alright, the next thing we're going to move on to as we're going down is your abdomen. Now, have you had any troubles with your bowel movement? Have you had any issues going to the restroom urinary-wise as well? Okay, and I would have you empty your bowel before we begin this exam. Have you emptied, not your bowel, your bladder. Have you emptied your bladder?
Yes.
Okay. Have you emptied your bowel as well?
Yes.
Okay, good. Perfect. Now, we're going to inspect your skin for any changes in color, temperature, moisture, texture, edema, turgor bruising, scars, lesions, anything out of the ordinary. Okay? Have you had any complaints of these?
No.
Any complaints of tenderness?
No.
Okay. Alrighty. Now, as we go, I'm just going to make sure that everything's in line and symmetrical in the abdomen, and it is. Okay, and then first, before I go any further, after I've inspected, I'm going to auscultate. First, I'm going to auscultate for the abdominal aortic artery, and then the renal arteries, iliac arteries, and femoral arteries to test for bruits. Bruits are so bad. And then we're going to auscultate for vowel sounds in all quadrants, okay?
That's okay, just
So for bruits, you listen for the vowel. Okay?
Yes.
Okay. And then again, like I said, we're going to auscultate your vowel sounds. Now, you auscultate in all four quadrants, and if you cannot hear vowel sounds within the time frame that you are listening, you are supposed to listen for a total of 5 minutes to make sure. Okay, and then I'm supposed to percuss in all four quadrants for tympany or dullness. Now, when I do percuss, let me know if you have any tenderness at any of the sites, okay? Any tenderness? Okay, great. Now we're going to, now I'm going to palpate, okay? You just tell me. Okay, and now I'm going to palpate for your liver. And if you palpate for the liver, tell them to breathe in and then breathe out. And your liver should float up to your hand. And then I'll palpate for your spleen, okay? Alright, the last thing I'm going to do today is check for CVA tenderness. If you could sit on the side of the bed for me, please. Alrighty. Now, CVO tenderness, you put this on the back and you just jam it. You feel good? And you tell me if it any hurting. Alrighty. We're good. Thank you.